right, I think we're just about ready. Okay, so before we move into our second session, so I'd love to take a brief moment to hear from both of our speakers together. You can answer this question. I'm directing this to Jessica and Dr. Michelle. So, given your years of experience working with TMJ patients, so what's one thing you consistently see in patients, regardless of age or presentation? It can be related to what's causing their pain, or what's been working, or what hasn't been working.
Well, one of the things that I often see, probably two major things, um, that the patient has been to multiple practitioners with no answers. The other one is airway issues. Is a really big cause, and it's in most adult patients as well as some children.
So yeah, I'm with you, Doc. Like definitely that airway issues and a lot of it being related to, like those tongue tie issues, as well. And just a lot of people telling you it's just stress. There's a lot more that goes into it's just stress, that's going on there. So I absolutely those would be probably my two biggest things that I'm seeing a lot of.
All right. Yeah, so thank you both. So it's always powerful to see when two professions or different disciplines align. So that's the entire point of our organization. We want to mobilize the entire network. And yeah, I do agree with Dr. Michelle. Oftentimes, patients have already seen multiple providers, and most of the care is usually siloed, which I think is a systemic problem. So, as a follow-up, after all these years in practice, what's something about TMJ that still surprises you?
Well, the complexity. I think a lot of people assume that it's just TMJ pain, but and I'll go a little bit more into it in my presentation. But my TMJ consults are an hour long, so um, they are often complex, and no two patients are the same.
Yeah, I would what always I would say surprises me the most, and I feel like I'm still doing a lot of learning on it, is the kind of connection, with the diaphragm as well as like pelvic floor dysfunction. So we kind of think like, well, if it's the TMJ, it's got everything, it has to be up here. Here's where we got to really look and focus. And oh my goodness, sometimes that's not where it started. It started,
Mhm.
kind of bottom up, and finally just made its way up there. So really learning that it's more than just this area that could be causing this TMJ pain.
And I think that's a really good point, and that's often why people come in and they don't have an answer. There are so many things to look at, and because it just spans across so many different professions, that professional looks just within their scope. But I think now, being a TMJ focused practitioner, you don't necessarily have to treat those things obviously outside of your scope, but you have to know how to look for them and know when they're a major contributing factor, and then refer accordingly. And so I think, Jess, you said before that you sort of have to build up a team, and that's, yeah, exactly right. You have to have those people to refer to.
Yeah. So yeah, those insights really highlight how complex TMJ is and the importance of having, you know, everyone on board. People should talk to one another, especially specialists. And I feel like that really, helps patients reach their desired outcomes sooner rather than, putting them in a state of confusion, which I think is heavily documented. So
Mm.
yeah, now let's transition into our next session. So Dr. Michelle Clark has a unique skill set. It's our first time speaking to a TMJ chiropractor. So she has extensive experience and postgraduate training on the management of TMJ dysfunction and craniofacial pain. She has advanced knowledge and on treating TMJ disorders, headaches, bruxism, mouth breathing, and orofacial pain. So Michelle has a particular interest in chronic and complex adult joint complaints or jaw complaints and pediatric jaw development. So she holds a Bachelor of Science degree majoring in physiology and biochemistry from the University of Melbourne, followed by a double degree of applied science and chiropractic science from RMIT University. So during chiropractic practice, she developed a strong interest in the TMJ and took advanced chiropractic TMJ training as well as completing courses in TMJ myofascial release and clinical neurology. Seeing many adults with similar presentations of jaw pain, bruxism, and jaw underdevelopment, she began digging deeper. So she discovered orofacial myofunctional therapy and the importance of jaw development in children, and took a particular interest in pediatric jaw development and early interventions. So she collaborates with other practitioners to address all aspects of TMJ dysfunction and has been in practice for over 20 years. So let's welcome Dr. Michelle, and you may start sharing your screen.
Thank you. Okay, so this is just a little bit about my 20s in practice. I want to outline this because I think this is a story that a lot of TMJ focused practitioners probably have. Within my training, you do get basic TMJ knowledge and how to treat TMJ, but knowing what I know now, it's quite minimal, and it can be a good place to start. But like a lot of other practitioners, advanced training comes from necessity. So very early on in my career, I saw only a few patients with TMJ issues, but somehow I became the practitioner to see in that clinic for TMJ problems. Which I sort of felt like a bit of an imposter. I didn't feel like I was an expert in that area. So that's what sort of started my journey. And I did some more training with TMJ chiropractors on how to look after TMJ patients much better. And then went into some clinical neurology and some advanced myofascial release training. So at that point, I thought I had a pretty good grip on it until I started seeing the same thing happening. Adult patients, you get them so far, but then their pain just either kept coming back or it wouldn't go. And one of the things that we were taught in the advanced chiropractic care for TMJ is that the high-risk patients are those adults with a narrow palate, and they've got some sort of breathing issue at night, so snoring or sleep apnea. So I started realizing that these are the patients that I was really struggling to get a really good result with. And I felt like it just didn't sit well with me. I couldn't leave it there. So I remember being quite frustrated and came home and just started researching. I knew there had to be more answers. And that's when I stumbled across orofacial myofunctional therapy. So if you're not sure what that is, it's to do with the function of the orofacial complex, what the tongue is doing and what it's not doing, the cheeks, the lips, but also how that all affects development of the palate in childhood. And that was like a light bulb moment for me. So I found providers in Australia that taught that, and then that sort of exploded my knowledge, and I had to learn even more than that. So I became a Maya-Munchie certified practitioner. I'll go into that a little bit more later. And then more training on oral ties. So you can see from that it's much more than what a standard practitioner would get. And I think that's across the board with many manual therapists and even dentists. They often have basic training. And if you look for a TMJ focused practitioner, you'll see that they have extra training. So I think that can be a key thing to look for when you're trying to decide who you're going to see. So I'll just go slide. So this is what I wanted to touch on today. With that theme of self-management, I think it's a really important thing to have a diagnosis or a good clinical picture of what's going on with your jaw, because it is very different from person to person. If you know and understand what's happening with your jaw, you can better self-manage when you have a flare up, and you know what you should and shouldn't be doing. But we still come back to that question of who do you see? I hear it time and time again. People are just really frustrated. They've spent so much time and money on seeing different practitioners and different treatments, night guards, Botox, and they're still in pain and they still have no idea what's going on. So I will touch on the difference between a standard practitioner, and that sort of goes across manual therapists and dentists, and a TMJ focused practitioner. There is a difference. And then we'll touch on diagnosis and what sort of things we look at, and how you know what's going on with your jaw. And then I'll give a chiropractic perspective on what a TMJ focused chiropractor does, as well as some self-management tips. So this is a diagram that represents how I view TMJ dysfunction. And as Jessica said before, when we're talking about TMJ, that's the joint, the temporomandibular joint. When we're talking about TMD, that's dysfunction or a disorder of the temporomandibular joint. So my perspective, when someone comes in, there is two sections, and at the very core of a TMD is what we have here in the center. We have what the muscle is doing and also what the joint is doing. So it's really important to look at both. Are the muscles really tight? Are they painful? Is there an imbalance? The jaw is really unique. So there's really nothing else like it, for a number of reasons. But the main one is, if the jaw is going to function really well, the left and the right sides have to be working perfectly in sync. There is a bit of give in that. The body can adapt. But if it's like that for a long time, then that's when we start getting dysfunction and pain. So we have a good look at the muscle, but also what is the joint doing? Is the lower jaw misaligned? Is the disc not sitting in the right position? Is there inflammation? Which one of these is the biggest pain source? And if you have muscle dysfunction, it can feed on joint dysfunction and vice versa. So if there is jaw pain and dysfunction, there is stress on the structures, and so there is going to be pain from muscle, joint, or sometimes it's both. So I'll just give a little example. Hopefully this video plays. This is one of the common things that we would see in practice. This is a really obvious one. We're trying to open. The jaw is going off to the side, and there may or may not be a click associated with this. So the key is to figure out what is going on there, and then the targeted treatment to be able to help that. Now that is just the first step. And I think this is a really important point, which we've already just touched on, but there are so many things that either cause or contribute to TMDs. So if we don't address things in this yellow section, that center blue portion, the dysfunction and the pain, is going to continue. So this is where, again, even if we can't actually treat all of these ourselves, it is really important to identify them and then have a team that we can refer to. So we've already touched on bruxism. If you are bruxing, clenching at night, that is going to continually place stress on the muscle and the joint. And a lot of people, as Jessica said, they're not even aware that this is happening. It's typically either from examination that we pick this up, whether it be wear on the teeth, or the masseters have become quite enlarged, or a partner is picking up on it. So particularly for those people that live alone, they often have no idea that this is happening. And then that will lead into breathing dysfunction, whether they're mouth breathing, whether they've got nasal congestion. So we really do need to get to the bottom of, well, why is that happening? And that's the sort of thing that we need to assess for. Manual therapists, massage therapists, chiropractors, osteopaths, they're all in a really great position to be able to not only identify this core part, but also treat it. And then the extra training comes in to be able to identify all of those things in the yellow section. And some of those, obviously, we can treat as well. We do look at posture as well as spinal joint function, in particular the upper neck. That is extremely important for the stabilization of the jaw, as well as tongue function and even movement of the jaw. So all of those things really do need to be assessed so that we're making sure we get everything. So that brings us back to, well, what is the difference between a chiropractor and a TMJ focused chiropractor? Some of this will also apply to those other manual therapists, like physiotherapists, PTs, osteopaths. We do get basic training, as I said previously, in a standard course, but it is fairly minimal. We certainly don't go into the extent of oral ties and looking at the airway. So one of the key things to look for in a practitioner that's focused on TMJ is that they have actually some extra training. Unfortunately, across the board, at least here in Australia, there's no set standard of training, and I think that adds to the complexity and the frustration of people finding answers. People that want to focus on the jaw, they just have to go out and look for that extra training themselves. So the key things to look for would be that advanced training, but also, as we said before, collaboration with other practitioners. Often it's multifactorial. There's not just one thing happening. And so we really do need the opinion and the treatment of other practitioners. So an insight into what happens in a chiropractic visit, as I said before, because of the complexity and the need to assess so many things, my TMJ consult is an hour long, and I think I know a lot of other manual therapists do something similar. So in that consultation, we will look at your history, which is a really, really important part. We want to know how long this has been happening. Was there an event that started this? Sometimes, well, actually, in a lot of cases, we can track things back to childhood. Not necessarily an event, but there were hints that TMJ dysfunction was starting to happen, whether it be clicking or a little bit of pain. We'll also look at your facial posture. As we've mentioned previously, are those masseters enlarged? Are you grinding and clenching? We'll look at the development. So is there an obvious asymmetry? Has the jaw developed asymmetrically? Is the lower jaw looking from the side? Is it sitting back and is it recessed? That gives us a huge clue into development and even airway issues that you may have. Again, as a manual therapist, we're going to look at your posture and spinal joint function. As Jessica's already mentioned, posture is really important. Even looking from the feet up, we're looking at the pelvis. In adults, pelvic floor can be related. But again, it's that rounded shoulder posture with the head forward. And that can indicate a lot of things, whether it be breathing issues, trying to open up that airway, particularly at night. I don't know if you've ever seen children with congestion and breathing issues, but you'll often see them sleeping and they've got their head back, sort of like what we're taught in CPR. If you're opening and extending the head, you're opening up the airway. And then, of course, spinal joint function. That's something a manual therapist can look at, both from the muscular perspective as well as the joint function. And then, of course, one of the main areas we're focusing on is how the jaw's moving, so the jaw biomechanics. We take quite specific measurements. We have a specific tool to measure how wide you're opening. We look at that in relation to your size. Obviously, someone that's quite petite, or if we're talking about a child, that opening is not going to be as much naturally as a 6-foot male. So I see a lot on social media, you know, if you can fit the 3 fingers in, you're all good. That's not necessarily the case. We do need to take into consideration what would be normal for you. So we look at the full opening. Is it restricted? Are you opening very wide for your size? That can be an indicator that you're hypermobile, and that is completely different, the treatment that we would do there, to someone that is quite restricted. So it's quite important. We measure side to side movement. That gives a good indication of what the discs are doing. Is your jaw opening straight? And is there any clicking? Where is the clicking happening? Is the jaw sore to touch? Is the joint sore? Is the muscle sore? Do you have pain with biting? That's a really good indicator of inflammation. And it can be muscular, but we have specific tests to indicate the difference. So you can sort of start to see why this is such a long consult. Then we're going to look inside the mouth. We get a lot of great information in there. We're going to look at the upper jaw and the lower jaw, the shape, and how wide it is. We actually take a measurement there. We want to know, has it developed quite narrow? And as Jessica said, if it hasn't grown wide enough, often that'll start to encroach on the nasal passage. It means that it may be wide, but you also may have a deviated septum. So we certainly look for signs of that. We want to get a good indicator of if there is any nasal obstruction. We'll look at your teeth and just see whether they're in occlusion. Sometimes some people have had dental work and it means it's completely changed their occlusion. And of course, any signs of wear that could indicate bruxism. We want to have a good look at the tongue position. So is it sitting high at the back? Is it starting to encroach on the airway? Is there enough room for your tongue? Is there enough strength, and is it functioning well? So we look at all of that, as well as having a look at the back of the airway. Is it elevating properly? Is it wide enough? Are your tonsils enlarged? And then we'll do quite a thorough assessment for oral ties and see if there's any missed lingual frenulum tie that may need to be addressed. So after all of that, if it's indicated, particularly if there are concerns with any numbness of the face, any tingling, we'll do a TMJ focused neurological exam and see if there is any potential neuropathy or neuralgia there. We also may choose to do an otoscopic exam. So a lot of people with TMJ issues, sometimes the only complaint is ear pain. So we want to make sure, is that coming from the ear, or is it a jaw issue that's being referred to the ear area? So we'll do an otoscopic exam to see whether there's any buildup of fluid, is there any redness? And then again, depending on what we've already found, we may choose to look more at your breathing. So that includes not only, are you breathing okay through your nose? We can use a pulse oximeter just to check the oxygen saturation while you're only breathing through your nose for a good 3 to 5 minutes. This is particularly helpful with children when we're seeing kids that may have nasal obstruction. But we'll also look at, are you using your diaphragm or your chest predominantly for breathing? That can have a big impact as well. And then if indicated, we'll do a more in-depth hypermobility exam. Is your jaw hypermobile? Is it part of something bigger? And then again, if indicated, if we're suspecting something is not right at night, if you're clenching, grinding, snoring, you have sleep apnea, I might get a patient to record their sleep for a few nights. I also usually recommend SnoreLab. I think it's a really user-friendly app, and it's really easy to get a good idea of what's going on. You just listen to the recorded sounds, and you'll be able to hear what's going on there. And then, of course, if needed, we will refer off for imaging, whether that be an X-ray or an MRI. All right, so some of the common things that come in, most people will have some form of muscular involvement. It's you're not going to see someone with jaw pain without muscle involvement. Now that can actually be the muscles of the jaw. I've certainly seen people that have complained of jaw pain. They've been referred to me, and their jaw is amazing. It is all coming from the neck. So the pain's usually referred from the neck muscles, and that is secondary to dysfunction in the spine. So that's why we want to check everything. But majority of the people coming in will have really tight and imbalanced muscles, and that can be a cause of why the jaw may go off to the side. Arthralgia, sometimes the pain source is coming from the joint itself. There can be muscle and joint involvement, and in fact there usually is, but the joint's not always the source of the pain. But we have specific examination techniques to be able to identify that. And of course, as you saw before in the video, it's really common to see the lower jaw on opening going off to one side. There are many different patterns of how that might occur. It may go off to one side and stay that way on full opening. You can have it go off to the side and then just slowly come back, off to the side, and then there's an abrupt click and an abrupt movement as it comes back to center. And then we have a classic S shape, which usually indicates instability and imbalance of the muscles. So again, depending on how it presents, the treatment's very different. Another common one is reduced mouth opening. There are some people that come in and they have no idea that their opening is so restricted, and that's just because it's happened gradually, and they've just been unaware. They've still gone on about their normal things, or of course it can happen really suddenly. I find that that's quite common after an event. So if they have been to the dentist and they've had either something like an extraction or a lengthy dental visit, that can often stimulate inflammation in the jaw, and then the muscles just suddenly contract. It can also be from a sudden locking of the jaw from the discs inside the joint being too far forward, and they just can't come back. Again, we need to know exactly why that's happening, because the treatment is very different. And then, of course, jaw clicking is probably one of the biggest ones. So we have hopefully this plays. This is just a little video to show what the jaw does on opening. So there's two phases of movement. The first one is a rotation or a hinge. And then you can see the lower jaw must slide forward, and the little disc, you can see that the white part there has to move forward with it. We should have a close-up. There we go. So there's the rotation, and then the disc must move forward with the lower jaw. That is really unique about the jaw. There's no other joint that does that. Now, when we have a clicking jaw, this is what happens. The disc starts in the forward position. So closed position. Here it is forward. There's a muscle attached to the front. When that is really tight, it pulls the disc forward. And that often happens when you're grinding at night. Slowly over time, that disc comes forward. And then, of course, once you open your mouth, if it's able to, it will click back to realign. A lot of people think the clicking is when the disc is misaligning. It's actually when it realigns. Next slide. All right, so a typical treatment then, based on all of that, from a chiropractor, and a lot of this will carry over into manual therapists, obviously within their scope. Really important, if we go back to that core biomechanical jaw dysfunction of the muscle and the joint, we want to be addressing both. Muscle release, often that is one of the big pain sources. So we really want to make sure we're starting to loosen those muscles. So part of the treatment is soft tissue techniques to help release the involved muscles. There's also specific joint techniques. So a lot of people just assume as a chiropractor, we're just going to crack the jaw. That is not the case. That can be done in certain circumstances, but there are actually really specific gentle joint maneuvers that we use depending on what's going on. So certain ones for a disc misalignment, there are certain maneuvers for an adhesed disc. Sometimes the disc can actually get stuck at the top of the jaw, and there's specialized ones for where the movement is asymmetrical. So we want to help get the jaw on track and calm the muscles. And then, of course, being a chiropractor, we will look at spinal care and posture and make sure that particularly the upper neck is not adding to the dysfunction and the pain of the upper jaw. And then an absolute must. It's very rare that I do not give exercises. There's a couple of presentations that we don't want to give exercises initially, particularly when the jaw is really, really inflamed. We want to get the inflammation down first. But an absolute must, because of the way that the jaw functions, the left and the right, they have to move in sync. If we leave the muscles as they are and they're imbalanced, that is just not going to happen. So it is absolutely essential. So I'll give jaw exercises, quite gentle ones within pain-free ranges of motion, nothing at the end range of motion where it's going to stress it. So we're quite careful about that. And just on that note, I do see people on social media saying this exercise will help. That's a possibility. But again, we want to make sure that those exercises are targeted to what's happening for you. There are some exercises that will make some jaw presentations worse. So you do need to be careful with that. And of course, given the orofacial myofunctional assessment that we do in the initial consult, we're also going to add into those exercises to help if we found low tongue posture or a dysfunctional swallow, or your lips were not strong enough and you can't obtain a lip seal. We address all of that and then regularly reassess. If something has improved, then we might swap that out, or we might swap it for a harder exercise just to really strengthen that up. And then, of course, posture is a big one. We'll definitely include postural exercises and just make sure we're addressing everything that we possibly can. But going back to that circle with all the yellow things or the things that can aggravate or cause your jaw problem, I can't address all of them. There is no one practitioner that can do everything. So it is so, so important to have a referral network. So if needed, I usually refer out. Super, super important. So when we're talking about referrals, the most common ones are ENTs. The amount of enlarged tonsils that I can see, nasal obstruction, or if someone is snoring, bruxing, and it's all because of their airway. It's really good to have a known ENT that's also on the same page. They understand the big importance of nasal breathing. Sometimes we need to refer to an airway dentist if we believe that your breathing issues are more from the airway down here at the back of the throat. Sometimes a mandibular advancement device, or a little splint to help bring just the jaw forward at night. That airway dentist would be very proficient in TMJ as well, because it's really important that they screen for certain elements of the jaw. There are some contraindications, so but that can make a big difference to you breathing at night. Sometimes that's indicated, and of course sometimes we need the help of a TMJ dentist. Most commonly for a splint at night, and it's a customized splint, so they look very carefully at your jaw and the position as well as your occlusion. Sometimes so that your jaw can heal, we can refer off to a TMJ dentist for a splint that puts your jaw in a better resting place, and that just can help the healing at night. And then, of course, there are other treatments. So a lot of people coming to me have already had Botox and a night guard. Now, these can be beneficial. Personal opinion, I don't think they're a great place to start. Botox, it can help if the pain is from certain muscles. Botox usually is injected into the masseter, sometimes into the temporalis, but there are other muscles that are pain sources. And of course, the pain can be coming from your neck muscles or your jaw joint. So it won't necessarily get on top of the problem. So it's something to keep in mind, but probably not a great first treatment for a TMJ issue. Night guards are very, very common. They can help in the situation where you just need to protect your teeth, as Jessica mentioned already. I think the issue with night guards is that people come away with a night guard thinking that that's the solution for their TMDs. They aren't properly informed that that's not actually going to stop the bruxism. So it can be a good option to protect the teeth, of course, but you still need to look into what's going on. You need a clear picture of what's going on with your jaw and what is causing the bruxing. Then, of course, we have maxillofacial surgeons, and they can be really good, particularly if you already know that there is potentially a surgical intervention needed. But again, I have a lot of people that was their first stop. So that's one option. Of course, there's medications out there that people have been given. Again, sometimes it's necessary to help manage the pain, but still look at the cause. And I have seen, probably not so much in Australia, I've seen this from people on social media where they get orthotic splints. So that could be something to look into. Not really up with those ones. So given all of that, there are some things I really wish people knew, that it was common knowledge, because these are the things that I just keep hearing, and it's quite frustrating. So hopefully platforms like this helps get the message out. But night guards absolutely do not stop grinding. They can be great at protecting the teeth, as already mentioned. However, in some cases, if you are having issues with breathing at night, some of them are quite big and bulky, and they can actually make that breathing worse. So that's something to consider. Clicking is not normal. It's usually a first sign of dysfunction. There is particularly one exception. I know Jessica mentioned hormone levels. I do find, particularly with females going through adolescence, sometimes they can have a little period of clicking, purely because of the changes in hormones, but you want to get that assessed and see if there's any dysfunction. Again, mentioned before, a very large cause of bruxing and grinding is sleep disordered breathing. I really wish this was well known across the board. The amount of people that I see, they've been suffering with TMJ pain for so long, and it's really obvious that they're not breathing properly. So that's a really big one. And of course, the importance of nasal breathing. The amount of people that are not aware that breathing through their mouth, whether it be during the day or night, that is not normal. Our nose was designed for breathing primarily. Our mouth was not designed to filter and humidify the air like the nose does. Of course, the other thing to consider is when the air is going through the nasal passage and through the sinuses, it picks up nitric oxide, which helps the efficiency of that carbon dioxide and oxygen exchange in the lungs. So we were definitely designed to breathe through the nose. And the other one, TMDs, they have multiple causes. It's very rare that you see someone coming in with only one cause. So it'd be good if more people were aware of that. Exercises are a must for TMJ. As I said before, there's probably only one real presentation that I would not give exercises. They are different for different presentations. So it's really tempting to just grab an exercise that someone has said has worked for them on social media, but please be aware some of them can actually make things worse. And that TMJ treatment, it's not a one size fits all. It needs to be individual for that person, or you run the risk of seeing yet another practitioner and you're not getting results. So that's really important too. So we'll go into some self-management tips, which I think Jess has already covered a lot of them. So I'll just go into a few. Avoiding triggers, the hard or chewy foods. That's a really common one. People will often have a relapse when they've bitten into something quite firm, or they've had a steak and it was like really chewy. Opening the mouth wide, particularly if you're going to bite into something like an apple or a hamburger. I usually advise patients, just don't do it, just cut it up. And then the other one is yawning. Yes, we all yawn, but if you are particularly in the middle of a flare-up, you want to use your fist just to help stop the extent of opening when you're yawning. That can help a lot. And having the mouth open for a prolonged period, chat with your dentist. As Jessica already mentioned, you can request a bite block. That just helps relax the jaw. You don't have to hold it open. You can rely on that bite block to not have to work so hard, and then just work with your dentist to have regular breaks if it's a lengthy visit. Sleeping, the big one is sleeping with your hand underneath your face. If you're laying on your side, you're pushing the jaw for a good portion of the night, that will place too much stress on the jaw. So I usually advise people to pop their hands underneath the pillow. That's a much better habit to get into so that it's not directly on your face. The parafunctional habits, the nail biting, the chewing on the pen lid, that can create it's repetitive force on the jaw and it's uneven. That can really start inflammation levels creeping up in the jaw. Chewing gum. Some people use this as a dental routine. So I would say if you can avoid it, particularly during a flare-up, but if you do really need to chew gum as part of your dental routine, break the chewy piece into two, or have two small parts so that you're chewing evenly, and also only chew for a very small amount of time, not all day. If it's just for a dental routine, it should only be a few minutes, 5 to 10 minutes or so. And then, of course, stress. Stress is a big one. In the past, it's been blamed solely as the cause of TMJ pain. That is not the case, as we've just seen. There are so many causes, but yes, stress can be a big one. If you know that you are prone to stress, and you've gone through a stressful situation. I think Jessica had some amazing points there on just how to bring yourself back down, teeth apart, tongue up on the roof, concentrate on your breathing. That's a really good one. If you are clenching during the day, some of the good resources are myospots. If you haven't heard of myospots, they're little spots that you can purchase that you place on the gum just behind your front teeth. Traditionally, they're used for retraining your tongue posture. But I've found that they work really well in people that clench during the day. So you use one, pop it up there, push it up. It will stick to that area of your gum. It won't come off after that. It will dissolve, and it takes a good 30 to 40 minutes to dissolve. But you can't help but play with it. Your tongue goes up to that spot immediately, and it naturally stops the clenching. So that can be a good one, particularly if you're in an office setting, because the next two may not be as appropriate. A Maya Munchie, again, that's not its traditional use, but a Maya Munchie is a little silicone, it's like a little mouth guard, and you pop it in, and it can help keep your teeth apart and your tongue up. So that could be a good option as well. Maybe not in a setting where you have to be talking. And then there are apps that if you search for bruxism apps, they'll just give you a little reminder throughout the day. Once you get that reminder, teeth apart, watch your posture, tongue up, that can help retrain to not clench during the day. And we've just mentioned that one, the tongue up, teeth apart, and focusing on nasal breathing. That can all help relax the jaw, but also calm the nervous system and rebalance the sympathetic and parasympathetic. And Jessica already mentioned self-massage. So there are a few techniques that you can find: massaging the masseter, the temporalis. There are some intraoral ones that you can try to release the lateral pterygoid mainly. I will caution with that. Sometimes that can set off TMJ pain if there are any indications of a neuralgia or a neuropathy. So that tends to be quite sharp pain. You can have neurological symptoms like tingling and numbness. Please be very careful if you have any of those symptoms. That's an indication to see a practitioner. The touching of the outside cheek or the inside cheek, that can set that off. We've also got heat and ice. What on earth do you use? How do you know? Heat is best for muscular pain. Ice is best for inflammation. So again, we come back to, if you know what is going on with your jaw, you have a much better chance of self-managing it yourself. So if you're aware of what's going on, and you read the signs, so an ache, particularly in the morning, is muscle. Heat will probably work better there. But if there is a sharp pain, especially after there's been an event of biting into something, or it's quite sharp, pinpointed right in front of the ear, it is most likely inflammation, and ice can work much better. Exercises, again, if you already have a diagnosis and you've been given some exercises, I'll often advise patients, once I've dismissed them from care, if things start to come back, if they start to creep up, go back to your exercises. That can help settle things down. Obviously, if there is significant inflammation, then I would suggest that you see a practitioner. So when to see a practitioner? Ongoing pain, if it's not resolving, the sharp shooting pain, tingling, numbness, definitely you need to see a healthcare professional. And of course, if the jaw suddenly locks closed, there can be a few different reasons for that. And Jessica also mentioned an open lock. That is definitely someone you'll need to see pretty quickly. Amazing. Thank you so much for listening.